Hi, this is Michaela, and in this video, I will be demonstrating the donning and doffing of PPE, sanitization, disinfection, and wrapping of instruments. First, perform hand hygiene. Use an alcohol-based hand sanitizer or wash your hands with soap and water to remove or kill germs on your hands before touching clean PPE, preventing contamination. Next is we put on the gown. Fully cover your torso and secure the gown around the neck and the waist. This provides a barrier to protect your clothes and skin from exposure to infectious materials. Next, put on your mask. Secure mask or respirator over your nose and mouth, ensuring a snug fit. This protects respiratory system by filtering out airborne infectious particles. Then we put on our eye protection. Place goggles or face shield over your eyes to protect eyes from splashes or droplets that could carry infectious agents. And lastly, put on the gloves. Extend gloves to cover the wrist of your gown. This ensures that your hands are fully covered, protecting against contamination from contact with surface or patients. Remove any visible debris from instruments by rinsing them under running water or soaking them in an enzymatic solution. Pre-cleaning helps to prevent the drying of organic material like blood or tissue, which can be harder to remove later and may harbor harmful microorganisms. Scrub instruments manually using a brush, soap, and water. Thorough cleaning removes organic debris and biofilm, reducing the microbial load before sterilization or disinfection. Rinse the instruments with clean water to remove any soap or cleaning solution residue. This ensures no chemical residue remains on instruments, which could interfere with disinfection or sterilization. Allow instruments to air dry or use a sterile cloth to wipe them dry. Ensuring instruments are dry prevents moisture from interfering with the sterilization process and reduces the risk of corrosion. Place instruments in an appropriate high-level disinfectant and follow the manufacturer's recommended contact time. Disinfectant solutions kill most bacteria, viruses, and fungi on instruments, making them safe for handling and preparing for sterilization. Select an appropriate size of wrapping paper that allows for adequate coverage of the instrument tray or individual instruments with enough material left for secure folding. Place the instruments in the center of the wrap, ensuring they are arranged in a functional position. For all instruments that have hinges, we need to make sure that they're all open. Make sure to put something like cotton to keep the hinges open. The reason for this is that we want the surfaces to be exposed to the incredibly hot air that will be created by the autoclave. The last item in the kit is an indicator. This will tell us that the temperature inside of our kit got the proper temperature that we need to be sterile. We want to make sure that the kit we're making can be easily opened without compromising the sterile nature of the instruments, so we make these little lips so someone can grab it and pull it open without touching the inside of the kit. Use sterilization indicator tape or special adhesive seals to secure the last fold in place. Wrap the tape around the final folds to hold the package together. Ensure that the tape does not obstruct the opening of the package but secures it snugly. Label the package with the contents, sterilization date, and other relevant information using sterile marker. This helps with inventory control and ensures that the instruments are used within the recommended time frame. Now that we've cleaned, disinfected, and wrapped our instruments, the final step in ensuring they are sterile and safe for use is to place them in the autoclave for sterilization. Carefully open the autoclave and position the instrument kit inside. Be sure not to overcrowd the chamber. The autoclave works best when steam can circulate freely around each package, ensuring effective sterilization. Once the kit is placed correctly, close the door securely and select the appropriate sterilization cycle based on the type of instrument and the material used for wrapping. For most surgical instruments, we'll use the standard system cycle at 121 degrees Celsius for 30 minutes. First, remove the gloves. Grasp the outside edge of the glove near the wrist and peel away from the hand, turning the glove inside out. Slide an ungloved finger or thumb under the wrist of the remaining glove. Peel the glove off and over the first glove, making a bag for both gloves. After this, perform hand hygiene. Next, remove the gown. Carefully unfasten ties, grasp the outside of the gown at the back of the shoulders, and pull the gown down over the arms. Turn the gown inside out during removal. Put in hamper or if disposal, put in garbage. And of course, hand hygiene. Next is your eye protection. Handle only by headband or earpieces. Carefully pull away from face. Put reusable items in appropriate area for cleaning or the disposable items into garbage. And lastly, remove your mask. Bend forward slightly and carefully remove the mask from your face by touching only the ties or elastic bands. And throw the mask in the garbage. And lastly, hand hygiene. That brings us to the end of the video on the proper donning and doffing of PPE, the proper cleaning, disinfecting, wrapping, and sterilizing of instruments. I hope this step-by-step guide has been helpful in understanding the importance of maintaining sterile instruments for patient safety. By following these essential steps, you can ensure that the instruments you use are properly sterilized and ready for any procedure. Thank you so much for watching!